My name is Alain. I am a member of the AATG, and as such, I am part of the RBD-COV Community Advisory Panel. You see, in the early days of HIV treatment, patients were not participants. They were considered as subjects in research. We were simply not heard. We were not listened to. And these were the times when it was about survival. It was not only about treatment, it was about survival. Therefore, we needed a voice, especially in the context where drugs were emerging. As for me specifically, I joined the AATG in 1997, but I had already been an activist with Active Paris working on treatment and research since the early 90s. That opened my eyes to the power of activism and to the need to empower communities. And this naturally took me into the RBD-COV project. When I was asked to join the Community Advisory Panel, it felt like it was a natural step. I had reviewed research protocols, I had exchanged extensively with researchers, and therefore I knew how critical it was to have the involvement of the community as early as possible in the process. So what drew me was the focus on people living with immunocompromising conditions, including people living with HIV. And actually, this is the reason why the AATG, with its HIV advocacy experience, was approached. In this sense, the CAP meant to bring in voices of the affected communities, because we're not talking about HIV specifically, we were talking about being heard in a non-HIV clinical trial. So you see, that was a major shift, and it made our participation in the trial even more important. The biggest challenge, making sure that the community was involved from the very, very start, and have participants be respected and listened to. So as CAP, we reviewed protocols, we gave feedback, we improved communications, and we made the trial more accessible to people. We also developed a psychosocial study within the project to have a better understanding of the needs and the experience of participants. And really, that was a key achievement. The result is that materials became more community-friendly, inclusive, and accessible. And that's just because of our early involvement in the process. We had a real seat at the table within the consortium with whom we built trust, including the pharmaceutical company developing the vaccine. Another key achievement was the Science Cafe, which is an open space where, with the researchers, along with the researchers, we showed the results to the participants. This was an event that's really worth mentioning because researchers rarely communicate in this way with participants. So for me, this project has demonstrated once more that community involvement brings better inclusion and better research. Actually, we are part of other projects, and we will keep working for early community involvement in these projects. It's a win-win for everybody. When we community get involved from the start, research becomes fairer, stronger, and more impactful.